Your brain weighs only about 3 pounds, yet it demands 20% of your body's total blood supply to function properly. Every single thought, memory, and movement depends on a constant stream of oxygen-rich blood flowing through delicate networks of vessels. But what happens when that blood flow becomes restricted? According to recent research from the National Institute on Aging, reduced brain blood flow is one of the leading causes of cognitive decline and dementia in people over 65. Yet most people and even some doctors miss the early warning signs until significant damage has already occurred. Medical studies show that brain blood flow typically decreases by approximately 20% between ages 30 and 70. This gradual reduction might seem harmless, but when blood flow drops below critical thresholds, brain cells begin dying. The result is vascular dementia, the second most common form of dementia after Alzheimer's disease, affecting millions of seniors worldwide. What shocked me when I researched this topic is that many of these blood flow problems produce subtle symptoms months or even years before diagnosis, memory lapses that seem like normal aging, balance problems attributed to getting older, mood changes dismissed as depression. But these aren't just aging. They're often early warning signs that your brain isn't getting the blood supply it desperately needs. In this video, I'll reveal 8 specific brain blood flow problems that cause dementia in seniors. Sign number 4 is so commonly overlooked that even routine medical checkups miss it, yet it's one of the most treatable causes when caught early. Before we start, I need to be crystal clear about something. This video is for educational awareness only. If you or someone you love shows any signs of cognitive decline or the symptoms we discuss, you must speak with a doctor immediately. Only a medical professional can properly diagnose brain blood flow problems and vascular dementia. Now, let's dive into the blood flow problems that could be silently damaging your brain right now. Problem number 8. Atherosclerosis, narrowing brain arteries. Atherosclerosis is the buildup of fatty plaques inside artery walls, and when this process affects the arteries supplying your brain, it creates a slow strangulation of blood flow that can lead directly to vascular dementia. Here's why this happens. Your brain receives blood through 4 major arteries, 2 carotid arteries in the front of your neck, and 2 vertebral arteries in the back. When cholesterol, calcium, and other substances accumulate inside these arteries, they form hard plaques that narrow the passage where blood flows. The process is gradual and insidious. You might not notice anything wrong for years while plaques slowly build up. But once arteries narrow by 50% or more, brain regions begin experiencing chronic oxygen deprivation. This leads to chronic cerebral hypoperfusion, meaning your brain isn't getting enough blood. Research from the Journal of Alzheimer's Disease shows that atherosclerosis in brain arteries is present in approximately 60% of people diagnosed with vascular dementia. The plaques don't just reduce blood flow, they also increase the risk of blood clots forming and blocking arteries completely, causing strokes. What makes atherosclerosis particularly dangerous is that it develops silently. You can't feel plaques building up inside your arteries. The first symptom might be a stroke or sudden cognitive decline when blood flow becomes critically reduced. The mechanism involves inflammation in artery walls. When cholesterol particles get trapped in the artery lining, your immune system tries to remove them. This triggers chronic inflammation that damages the artery wall and promotes more plaque buildup, creating a vicious cycle. If you're over 65 with risk factors for heart disease, you're also at risk for brain atherosclerosis. The same lifestyle factors damaging your heart arteries are simultaneously damaging your brain arteries. Schedule comprehensive cardiovascular evaluation, including carotid ultrasound, to check for plaque buildup. Early detection allows treatment with medications, lifestyle changes, or procedures to restore blood flow before permanent brain damage occurs. Problem number 7. Small vessel disease affecting tiny brain arteries. While large artery problems get most attention, small vessel disease affecting the tiniest brain arteries deep inside your brain is actually more common and just as dangerous for causing vascular dementia. Here's why this happens. Your brain contains millions of microscopic blood vessels, each thinner than a human hair, that penetrate deep into brain tissue, delivering oxygen and nutrients to individual brain cells. When these tiny vessels become damaged and diseased, they can't maintain adequate blood flow to the brain regions they supply. Small vessel disease involves damage to the walls of these microscopic arteries. The walls thicken and become less elastic. Some vessels become completely blocked. Others develop weak spots that leak blood into surrounding brain tissue. Research published in Stroke Journal found that small vessel disease is present in approximately 95% of people over age 60, though severity varies dramatically. The mechanism involves several processes happening simultaneously. High blood pressure damages the delicate walls of small vessels. Diabetes causes inflammation and oxidative stress that further injures vessel walls. Age-related changes reduce the vessel's ability to repair themselves. What makes small vessel disease particularly insidious is that it affects brain regions deep inside, areas controlling memory, executive function, and emotional regulation. Damage accumulates gradually through countless tiny injuries, each one destroying small clusters of brain cells. On brain imaging, small vessel disease appears as white matter hyperintensities, bright spots on MRI scans indicating areas where brain tissue has been damaged by poor blood flow. The more white matter damage, the greater the cognitive impairment. You might notice symptoms like slow thinking, difficulty with complex tasks, problems with attention and concentration, or subtle personality changes. These symptoms develop gradually over years, making them easy to dismiss as normal aging. A study in neurology following 600 seniors for 5 years found that those with severe small vessel disease were 4 times more likely to develop dementia compared to those with minimal disease. If you're experiencing cognitive changes, particularly problems with thinking speed or executive function, brain MRI can detect small vessel disease. While there's no cure, aggressive management of blood pressure, diabetes, and cholesterol can slow progression and preserve cognitive function. Problem number 2. Carotid artery stenosis restricting flow to brain. The carotid arteries in your neck are the main highways delivering blood to your brain. When these critical arteries become severely narrowed by plaque buildup, your brain's blood supply becomes dangerously restricted. Here's why this happens. Carotid artery stenosis means narrowing of these arteries, usually caused by atherosclerosis. As plaques build up on artery walls, they gradually restrict the opening where blood flows. When narrowing exceeds 70 to 80%, blood flow to the brain becomes significantly reduced. Research shows that severe carotid stenosis is present in approximately 5 to 10% of people over 65. The mechanism involves both chronic reduced blood flow and acute stroke risk. When your carotid arteries are severely narrowed, your brain operates on reduced blood supply all the time. This chronic hypoperfusion damages brain tissue gradually. Additionally, plaques in carotid arteries are unstable. Pieces can break off and travel to brain arteries, causing strokes. What makes carotid stenosis particularly concerning is that it often progresses without symptoms until it's severe. You might feel completely normal while your carotid arteries narrow to dangerous levels. When symptoms do occur, they're often warning signs of impending stroke. Transient ischemic attacks are brief episodes of stroke symptoms that resolve within minutes to hours. Common symptoms include sudden weakness or numbness on one side of the body, temporary vision loss in one eye, difficulty speaking, or sudden dizziness. If you have cardiovascular risk factors, carotid ultrasound screening can detect dangerous narrowing before symptoms occur. When severe stenosis is found, treatments including carotid endarterectomy surgery or carotid stenting can restore normal blood flow and dramatically reduce stroke risk. Problem number 1. Chronic inflammation damaging blood vessel linings. Perhaps the most fundamental and widespread problem affecting brain blood vessels is chronic systemic inflammation, a smoldering fire that damages vessel walls throughout your brain and body. Here's why this happens. Inflammation is your body's response to injury or infection. In the short term, it's protective, but when inflammation becomes chronic and low-grade, persisting for years, it actively damages tissues including the delicate blood vessels in your brain. Research shows that people with elevated inflammatory markers have significantly higher risk of cognitive decline and dementia. Studies found that those with the highest inflammation levels were 2 to 3 times more likely to develop dementia. The mechanism involves direct damage to the endothelium, the single-cell thick lining inside every blood vessel. Inflammatory molecules circulating in your blood attach to endothelial cells, activating them. This attracts white blood cells that infiltrate the vessel wall, releasing more inflammatory chemicals. What makes chronic inflammation particularly insidious is that it's driven by factors you might not associate with brain health. Obesity generates inflammatory molecules. Chronic infections maintain elevated inflammation. Sleep apnea causes inflammatory surges. Sedentary lifestyle and poor diet promote inflammation. You might not feel inflamed. Chronic low-grade inflammation typically causes no obvious symptoms until it's caused significant damage. But blood tests measuring inflammatory markers can detect it early. If you're concerned about brain health, reducing chronic inflammation should be a top priority. Mediterranean-style diet reduces inflammatory markers. Regular exercise has powerful anti-inflammatory effects. Maintaining healthy weight, treating sleep apnea, and addressing chronic infections all reduce inflammation. What you must do next. If you recognize risk factors for any of these brain blood flow problems, don't panic, but don't delay either. These conditions are manageable when caught early. First, schedule a comprehensive evaluation with your doctor. Be specific about any cognitive changes you've noticed. Mention all cardiovascular risk factors, including high blood pressure, diabetes, high cholesterol, atrial fibrillation, or family history of stroke. Second, request appropriate testing. Brain MRI can detect silent strokes and small vessel disease. Carotid ultrasound checks for dangerous narrowing. Blood tests assess cholesterol, blood sugar, and inflammatory markers. Third, address modifiable risk factors aggressively. Control blood pressure below 130/80. Manage diabetes with A1C below 7%. Treat high cholesterol. If you have atrial fibrillation, discuss anticoagulation therapy. Fourth, adopt brain protective lifestyle habits. Mediterranean diet protects brain blood vessels. Regular exercise improves blood flow and reduces inflammation. Quality sleep allows brain blood vessels to clear waste products. Remember, your brain depends on constant blood flow to function. When that blood flow becomes compromised through any of these 8 problems, your cognitive function suffers. Which of these 8 blood flow problems surprised you most? Have you or someone you love experienced any symptoms suggesting reduced brain blood flow? Share your thoughts in the comments below. If this information helped you understand the connection between blood flow and dementia, please like this video and subscribe to our channel. Share this video with anyone who needs this information. Early recognition of these blood flow problems can literally prevent dementia or slow its progression. Remember, knowledge is power, but only when you act on it. If you recognize risk factors for reduced brain blood flow, make that doctor's appointment today. Your brain health is worth protecting. Problem number 6. Chronic high blood pressure damaging blood vessel walls. Chronic high blood pressure or hypertension is perhaps the single most important modifiable risk factor for vascular dementia. When your blood pressure remains elevated year after year, it silently damages the delicate blood vessels supplying your brain. Here's why this happens. Normal blood pressure creates gentle rhythmic pulses as blood flows through your arteries. But when pressure is chronically elevated, those gentle pulses become forceful hammering that damages artery walls with every heartbeat. Inside your brain, where blood vessels are particularly delicate, this constant mechanical stress causes serious damage. The vessel walls thicken to withstand the pressure. They become stiff and less able to dilate when brain regions need extra blood flow. Small tears develop in vessel linings, triggering inflammation and scarring. Research from the Lancet Neurology shows that people with untreated high blood pressure in midlife have a 60% higher risk of developing dementia later in life compared to those with normal blood pressure. The mechanism involves both large and small vessels. In large arteries like the carotids, high pressure accelerates atherosclerosis. In the tiny vessels deep in your brain, high pressure causes the small vessel disease that destroys white matter. High blood pressure also increases the risk of both types of stroke. What makes hypertension particularly dangerous for brain health is that it often causes no symptoms. You can have dangerously high blood pressure for years without feeling anything wrong. Meanwhile, your brain's blood vessels are being damaged every single day. The relationship between blood pressure and dementia risk isn't linear. Research shows that systolic blood pressure over 140 significantly increases dementia risk, and risk continues climbing with higher pressures. You might not notice cognitive effects for decades, but by your 60s or 70s, the cumulative damage from years of high blood pressure manifests as memory problems, slow thinking, and eventually vascular dementia. If you're over 65, regular blood pressure monitoring is essential. Home blood pressure monitors allow daily tracking. If readings are consistently elevated, aggressive treatment with lifestyle changes and medications can protect your brain from further damage. Problem number 5. Diabetes causing inflammation and vessel damage. Diabetes doesn't just affect your blood sugar. It creates a cascade of changes that specifically damage the blood vessels supplying your brain, significantly increasing your risk of vascular dementia. Here's why this happens. When blood sugar remains chronically elevated, glucose molecules attach to proteins in your blood vessel walls through a process called glycation. These glycated proteins trigger inflammation and oxidative stress that damages vessel walls throughout your body, including in your brain. Research from Diabetes Care shows that people with type 2 diabetes have approximately double the risk of developing dementia compared to those without diabetes. The risk is even higher for people with poorly controlled diabetes or those who've had diabetes for many years. The mechanism involves multiple pathways of damage. High blood sugar directly injures the endothelium, the delicate inner lining of blood vessels. This impairs the vessel's ability to dilate when brain regions need extra blood flow. Diabetes also accelerates atherosclerosis, causing faster plaque buildup in brain arteries. It increases inflammation throughout the body, including in the brain, which damages both neurons and blood vessels. What makes diabetes particularly dangerous for brain health is that it affects both large and small vessels simultaneously. Large arteries develop atherosclerosis faster. Small vessels deep in your brain suffer the microvascular damage that destroys white matter. You might notice cognitive symptoms years before a dementia diagnosis. Studies show that people with diabetes perform worse on memory tests and have slower processing speeds compared to those without diabetes. The relationship between blood sugar control and brain health is clear. The higher your average blood sugar over time, measured by hemoglobin A1C, the greater your risk of cognitive decline. Each 1% increase in A1C above normal range increases dementia risk by approximately 20%. If you have diabetes or prediabetes, aggressive blood sugar management protects your brain. Keeping A1C below 7%, maintaining steady blood sugar without wild swings, and addressing all cardiovascular risk factors can significantly reduce your dementia risk. Problem number 4. Silent strokes accumulating without symptoms. This is the problem that shocks people most because silent strokes happen without any obvious symptoms, yet they're one of the most common causes of vascular dementia in seniors. Here's why this happens. A silent stroke occurs when a small blood vessel in your brain becomes blocked, cutting off blood flow to a tiny region of brain tissue. The affected area dies, just like in a regular stroke. But because the region is so small or located in a part of the brain that doesn't control obvious functions like movement or speech, you don't notice anything wrong. Research published in the Journal of the American Medical Association found that silent strokes are incredibly common. In people over 65 with no history of stroke symptoms, brain MRI scans reveal evidence of previous silent strokes in approximately 25 to 30%. That's 1 in 4 older adults walking around with brain damage they don't know about. The mechanism is similar to regular strokes. A blood clot blocks a small artery or a diseased vessel becomes so narrow that blood flow stops. Brain cells downstream from the blockage are starved of oxygen and die within minutes. What makes silent strokes particularly insidious is their cumulative effect. One silent stroke might destroy such a small brain region that you truly notice nothing, but multiple silent strokes over time destroy enough brain tissue to cause noticeable cognitive impairment. Studies show that people with multiple silent strokes on brain imaging have significantly worse cognitive function. Memory, executive function, processing speed, and attention are all affected. The damage is permanent. Once brain tissue dies from a stroke, it doesn't regenerate. Each silent stroke leaves a small scar in your brain. As these scars accumulate, they disrupt the neural networks your brain depends on for normal cognitive function. You might notice subtle changes that you attribute to normal aging, taking longer to find words, difficulty multitasking, problems with complex decision-making, slower walking speed. These seemingly minor changes often reflect accumulated damage from multiple silent strokes. What makes this particularly important is that silent strokes predict future problems. People with silent strokes on brain imaging have 3 to 4 times higher risk of suffering a major symptomatic stroke in the future. They also have significantly higher risk of progressing to vascular dementia. If you're over 65, especially with cardiovascular risk factors, consider discussing brain MRI with your doctor, even if you have no symptoms. Detecting silent strokes allows aggressive risk factor management to prevent additional strokes and slow cognitive decline. Problem number 3. Atrial fibrillation causing blood clots to brain. Atrial fibrillation, an irregular heart rhythm affecting millions of seniors, dramatically increases the risk of stroke and vascular dementia by allowing blood clots to form in the heart and travel to the brain. Here's why this happens. In normal heart rhythm, the upper chambers of your heart contract regularly and completely, pushing blood efficiently into the lower chambers. But in atrial fibrillation, the atria quiver chaotically instead of contracting normally. This irregular quivering doesn't pump blood effectively. Instead, blood pools and swirls in the atria, creating conditions where clots can form. When a clot forms in the heart and breaks loose, it travels through your bloodstream until it reaches an artery too narrow to pass through. When this happens in a brain artery, it causes an ischemic stroke by blocking blood flow. Research from the American Heart Association shows that atrial fibrillation increases stroke risk by 5 times compared to normal heart rhythm. Approximately 15 to 20% of all strokes occur in people with atrial fibrillation. The mechanism involves irregular blood flow activating clotting factors. The stretching and inflammation of atrial walls from the abnormal rhythm further promotes clot formation. What makes atrial fibrillation particularly dangerous is that it often causes no symptoms. Many people have atrial fibrillation without knowing it, discovered only when they suffer a stroke or during routine medical examinations. Some people feel palpitations or fatigue, but others feel completely normal despite having dangerous irregular rhythm, allowing clots to form. The relationship between atrial fibrillation and dementia extends beyond stroke risk. Studies show that people with atrial fibrillation have higher rates of cognitive decline even without obvious strokes, possibly due to silent strokes or reduced blood flow from inefficient pumping. You might not realize you have atrial fibrillation until something serious happens, but irregular pulse warrants immediate medical evaluation. If you're diagnosed with atrial fibrillation, anticoagulation therapy with blood thinners dramatically reduces stroke risk. Studies show that proper anticoagulation reduces stroke risk by approximately 70%, making it one of the most effective treatments for preventing dementia.